All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Today we're talking about concussions as it relates to low estrogen. So we did a talk last week, I think on Saturday, about concussions and low testosterone for those who have gonads, which are testicles. Today we're talking about low estrogen in those who have gonads, which are ovaries. So, with that being said, today we're going to talk about some of the research on this. Again, at Gates Brain Health, we focus on brain health. We do what's referred to as functional neurology. Functional neurology emphasizes rehabbing damaged parts of the brain, such as in traumatic brain injury, using neuroplasticity-based exercises. What does that mean? It means basically trying to stimulate areas of the brain through sensory stimulations, eye exercises, complex motor stimulations, in an attempt to rehab those damaged areas, and then also consider the underlying biochemical factors which are disturbing neurophysiology, which may be inflammatory, may be hormonal dysfunction, may be vitamin deficiencies. And those layers are in the systems-based biology field, and they kind of layer on themselves, and it gets kind of complicated kind of quick. But nonetheless, that's what we do. So moving on, first article is out of behavioral neurology, and this article looked at basically hormones coming from the pituitary as well as estrogen levels and cortisol levels after a head injury. And they basically found that traumatic brain injury does reduce a woman's ability to, or let's say someone who has ovaries, their ability to produce estrogen. Interestingly, if they're on pre-existing birth control, that can affect their cortisol levels differentially if they're not on birth control. It seems that if they're on birth control, if I remember correctly, if they're on birth control, then cortisol levels will actually be higher. But in the study, as you can see here, this current study provides initial evidence that women with predominantly a mild TBI versus those with moderate to severe TBI may also have significant hormonal changes in response to the injury, and these TBI effects increase as severity of the injury increases. So the reason why I wanted to do a talk on this is just because lots of times when we're discussing TBI, because TBIs more commonly occur in men, most of the research is focused there. TBIs are very common though in females and soccer players and many different sports, and so I think it's important to focus on the hormonal dysfunction there, and it is consistent with what we see in men minus the elevation in cortisol. So if you watch the hormonal broadcast, or I think it was the adrenal fatigue broadcast, in there I talked about research showing that commonly in men the cortisol will actually go low, but adrenaline will go really high. And when adrenaline is really high, that tends to break down the gut and have a variety of other negative circumstances or consequences. So here in women, the gonadal hormone goes down, so estrogen goes down, but cortisol can go up. So that's important. And here what they're saying is that, even in mild traumatic brain injuries, which lots of times are poo-pooed, so to speak, because somebody doesn't have a skull fracture, they don't have a brain bleed, but they have a concussion. In concussion patients who are female, there is hormonal disturbance. So that has been documented. The effect of gender on patients with moderate to severe head injuries. This is from Journal of Trauma, I believe, 2009. Basically, I put this in here because they showed that estrogen does have a neuroprotective effect in the brain. Because one of the other questions is, why do women tend to do better or fare better after traumatic brain injuries than men? And they're finding that estrogen and progesterone are neuroprotective for the brain. So who knows? Maybe in the future, guys who have traumatic brain injury, they're going to study, injecting them with estrogen and progesterone and see if that helps them. That's something that's being discussed. So basically, this top highlighted section says exactly what I just said. But you can see that this comes from some robust data. So the Dr. Phelan basically looked at 218,000 patients with TBI from the National Trauma Database and found that gender to be associated with improved survival rates in people who are, past puberty. So basically the female gender is associated with improved survival rates. So interesting data, but nonetheless, if you are a female and you've had a concussion and you've developed post-concussion syndrome and you're not coming out of it, another important thing to look at, aside from all the stuff that I'm talking about, from leaky gut to POTS to damage to the axons of the brain, you may want to have your doctor check your hormones, because that's something I do on almost every TBI patient I work with. So let me know your thoughts, send us your questions, and I'll jump over to Facebook to see if we have any comments that we need to go through. And good morning to everyone who's joined. Interesting question. Can you have a TBI without any impact? Super great question. So what I would say is that some of that information has come from the car accident literature, where they've shown that in a car accident, from the whiplash itself can create brain strains equivalent to an NFL head impact. So yeah, you can hit the headrest, but just the whiplash effect, there's so much torque on the brain that is thought to be able to create a concussion. So that's my answer to that. The last time I reviewed that article was probably 2017, or reviewed that issue. But yeah, I would say it is definitely a possibility. All right. Well, any other questions, send them to me, and thank you all for joining. Again, summary: if you know a female who's had a concussion and they're not coming out of the symptoms, then maybe have them get their hormones checked. Okay, noted. All right, well, have a great day, guys, and I will talk to you soon.